Hi, I'll quickly explain in this short video about Kangaroo mother care. We all know the benefits of skin to skin care. It's one of the steps of baby friendly hospital initiative, and we encourage starting skin to skin care right from the time of delivery. Early skin to skin care, early breastfeeding, these are supposed to stimulate breastfeeding. Successful breastfeeding is more likely, and the mother infant bonding, the ability of the mother, the confidence of the mother to recognize the baby's cues appropriately, all these are impacted by this. When the baby is looked after in the NICU, we have something called Kangaroo mother care. We encourage that as soon as the baby is stable, we don't wait even if the baby is on ventilator, provided the umbilical lines are not in. Some units do that with umbilical lines or ET tube as well, but some units where the nursing support is not as established, or the staffing pattern doesn't encourage any. Obviously there is a risk of the tube pulling out or the lines coming out, there may be bleeding. So the unit has to decide whether they want to take that risk, or they will wait for the lines to come out, baby to be extubated to non-invasive mode. But once the lines are out, even if the baby continues to have the ET tube, securing the ET tube is easier than securing the lines and the ET tube together. So Kangaroo mother care is where the mother snuggles the baby on her chest, on the bare chest, and is wrapping the baby around. Father can do it as well. You can call it Kangaroo father care. There are innumerable benefits of Kangaroo care. One is obviously the bonding. The mother's feeling is going to be positive, and her breast milk output is going to improve dramatically. The baby is already familiar with the mother's heartbeat from the womb. It's going to reassure them. The baby is in a stressful environment in the NICU, and calming them down, you feel the heart rate of the baby coming down. The baby is much less stressed, copes better with the overall procedures. Growth is better as well, and because the mother has healthy bacteria, and the baby is going to be colonized with the mother's own skin bacteria when the mother does skin to skin care, there is a resistance to the hospital acquired infections from skin to skin care as well. There are multiple studies, and actually in the developing countries, involving the mothers more and more, because you are in a relatively resource deprived, resource limited situation, and there is a high risk of infection. The nurse to patient ratio is not appropriate in some cases, so making the mother learn how to look after the baby. Most of the premature babies just need support with feeding and monitoring and temperature care and so on. So the mother can be taught to do all this, and there are many studies in the developing countries which have come out where Kangaroo mother care is very good, effective, and if the mother is trained, they can look after the baby successfully. The WHO guidelines for prematurity, care of premature babies, brings in Kangaroo mother care as a very positive benefit as well. So if your baby is premature and is in the NICU, discuss with the doctors about when they can start skin to skin care for your baby in a safe way. Don't be worried. Obviously the nursing team is experienced and they will guide you on how to do it. I have explained earlier, don't look at the monitors because you'll be scared looking at the fluctuations. Always, if there is a concern, call the nurse and they will attend to it. Enjoy the process. It will definitely help both you and your baby, and involve your husband in the process. Of course, hygiene is important. Hand washing, wearing clean clothes, having a shower before you come for the skin to skin, all these basic practices are important. I hope this helps. Thank you.